Her first all-hands meeting started with a slide that said, "Modernization begins now." I knew then that someone was about to get hurt. My name is not important. What's important is that for 19 years, I was the Senior Director of Regulatory Affairs at Resigned Pharmaceutical, a mid-sized drug manufacturer based in New Jersey that held 7 active FDA approvals and 2 biologics licenses. I was what the industry calls a named individual. My name, my credentials, and my signature appeared directly in federal submission documents, not as a formality, as a legal requirement. When the new chief operating officer walked into that meeting, I had already read her LinkedIn profile twice. Margaret had an MBA from Wharton, a background in consumer goods, and 3 years running operations at a snack food company in Ohio. She had never worked a single day in a regulated pharmaceutical environment. I noted that. I said nothing. She opened by telling us the company had been operating like it was still 2005. She used the word legacy 4 times in 11 minutes. Every time she said it, she looked at the people who had been there the longest. People like me. I had spent 19 years building something that most people in that room didn't fully understand. Our FDA approval for a flagship blood pressure medication had taken 8 years to earn. The biologics license required a dedicated quality system, validated processes, and personnel qualifications that were woven into the actual language of the approval. Change the wrong thing without notifying the agency and the approval doesn't just get questioned, it gets suspended. Margaret didn't know any of that yet. Or maybe she did and didn't think it applied to her plans. Either way, she ended the meeting by announcing that the company was entering a new chapter of operational efficiency and that changes would be coming at every level. I drove home that evening, made dinner, and didn't say a word about it to anyone. 3 weeks later, my direct supervisor called me into his office. He looked uncomfortable, which told me everything before he opened his mouth. He explained that Margaret had been reviewing organizational structure and had identified what she described as redundancies in senior leadership. He said the company would be creating a new role, Vice President of Regulatory Strategy, and that the position would be filled by someone Margaret was bringing in from outside. I asked who. He hesitated. Then he told me it was Margaret's nephew, 28 years old, 2 years out of a master's program in health administration. No FDA submission experience, no named individual history, no industry relationships. I nodded slowly. My supervisor looked at me like he expected me to argue. I didn't. I asked if my current role was being eliminated or restructured. He said restructured. I would report to the nephew, whose name was Tyler, and my responsibilities would be realigned to support his strategic vision. I told him I understood. I asked for the conversation to be documented in writing. He looked surprised by that. I told him it was just for my records. He agreed and I left his office. That night I pulled out a folder I kept in my home office. Inside it were copies of every FDA submission in which my name appeared as a designated responsible official. 7 new drug applications, 2 biologics license applications, 14 supplements and amendments, post-market safety reports, annual product reviews. In regulatory pharmaceutical work, the named individual isn't a title, it's a legal designation. The FDA doesn't just approve drugs. It approves specific people at specific companies to be responsible for specific products. Swap that person out and you don't just have an HR change, you have a compliance event. I already knew what was coming. I just needed to decide how I wanted to be standing when it arrived. Tyler started the following Monday. Margaret introduced him at a department meeting as a transformational thinker with fresh perspective. He was wearing a suit that cost more than my first car. He shook my hand and told me he'd been reading up on the department and had some exciting ideas about streamlining our documentation processes. I smiled and asked what kind of streamlining he had in mind. He mentioned reducing what he called redundant review cycles and potentially consolidating some of our submission tracking systems. He said the current process looked over-engineered for what it actually needs to do. I asked if he had reviewed our current FDA consent agreements. He paused. He said he was still getting up to speed on the specifics. I told him that sounded like a good plan and that I was happy to support however I could. Then I went back to my office and started updating my resume. Over the next 6 weeks, I did my job exactly as I had always done it. I attended every meeting. I completed every assignment. I responded to every email. I did not volunteer information that wasn't asked for, and I did not warn Tyler or Margaret about the regulatory architecture they were walking through without a map. That wasn't obstruction. They had every resource available to them. They had consultants they could have hired. They had legal counsel on retainer. They simply didn't ask the right questions because they didn't know enough to know what questions to ask. Tyler began implementing changes quickly. He was eager to show results. He consolidated 2 review teams into one, which reduced headcount and looked good on a slide. He replaced our legacy submission tracking software with a commercial project management tool that was not validated for regulated use, which meant it didn't meet 21 CFR Part 11 requirements for electronic records. He approved a new vendor for API sourcing on one of our approved products without initiating a chemistry, manufacturing, and controls supplement to our existing NDA, a required FDA notification for any manufacturing change. I documented all of it, not loudly, not by sending memos up the chain, just quietly in my own files with dates and specifics, the way I had been trained to document everything for 19 years. In week 7, Margaret called me into her office directly. Tyler was there too. She told me she had been observing my adjustment to the new structure and felt I wasn't fully embracing the direction the company was taking. She said I seemed resistant. She said the company needed people who were aligned with the vision. I asked her what specifically she had observed that concerned her. She mentioned that I had raised questions in a recent meeting about the new vendor approval process. She characterized my questions as obstructionist. I told her I had raised those questions because the process as described did not include a required regulatory filing. She told me that Tyler had reviewed the requirements and determined the change fell below the threshold for a supplement. I looked at Tyler. He looked back at me with the confidence of someone who doesn't yet know what they don't know. I told them both that I wanted my concern documented. Margaret said that was fine and that she hoped going forward I could be a more collaborative member of the team. I thanked her for her time and left. 2 days later, I submitted my resignation. 4 weeks' notice, as my contract required. I did not make a scene. I did not send a company-wide email. I did not tell anyone I thought the place was about to collapse. I just gave notice, worked my remaining 4 weeks with the same professionalism I had brought for 19 years, and on my last day I shook hands with the people I respected, picked up a small box of personal items, and drove home. My departure triggered something that Tyler and Margaret hadn't accounted for, because they hadn't known it existed. When a named individual leaves a pharmaceutical company, the FDA requires notification. This isn't optional, and it isn't minor. For each application in which I was designated, the agency had to be informed that the responsible official had changed. That notification opens a review window. During that window, the FDA looks not just at the personnel change, but at the overall compliance posture of the applications involved. The agency has seen this before. A key person leaves. A company scrambles to name a replacement, and in the scramble, things get examined that might otherwise have stayed quiet. The FDA is not in the business of letting that window pass without looking through it. I was 3 weeks into my new consulting position. I had been contacted by 2 firms within days of my LinkedIn status changing, when I got a call from an old colleague still at Resigned. She spoke quietly, like someone trying not to be overheard. She told me the FDA had sent a 4083 observation letter following a triggered inspection. Then a warning letter followed. It cited 3 items: the unvalidated electronic record system, the undocumented manufacturing change, and a post-market safety reporting gap that Tyler's consolidation of the review teams had created without anyone noticing. A warning letter is not a fine. It is a formal notice that the FDA has found significant violations and that the company must respond with a corrective action plan within a defined time frame. If the response is inadequate, the next step can be a consent decree, a court-enforceable agreement that can include halting manufacturing, restructuring compliance systems under agency supervision, and paying for an independent monitor at the company's expense. Resigned's stock dropped 11% the day the warning letter became public. Their pending partnership deal with a European pharmaceutical distributor, valued at somewhere north of $60 million, was put on hold pending resolution of the compliance issues. The European company's regulatory team could not sign off on a distribution agreement with a manufacturer under an active FDA warning letter. I heard about that from 2 different people on the same afternoon. Margaret resigned 6 weeks after the warning letter. I don't know the specific circumstances. I don't need to. Tyler's position was quietly eliminated in a restructuring announcement that was released on a Friday afternoon, which is when companies release things they don't want people to pay attention to. The board brought in an outside regulatory consulting firm to help rebuild the compliance infrastructure. I know one of the partners at that firm well. I didn't call him, he called me. He asked if I would be willing to consult on the remediation effort. I told him I appreciated the call and that I would think about it. It took exactly 24 hours before I responded. Not because I needed the time, but because some pauses are worth taking deliberately. I agreed to consult, at a day rate that reflected 19 years of expertise and the current circumstances. The engagement lasted 8 months. Veridan's corrective action plan was accepted by the FDA. Their manufacturing resumed full operations. The European deal eventually closed, though at a reduced valuation and with additional compliance warranties attached. I was not there to see any of that. I had moved on to other work by then. I had 2 long-term client relationships, a waiting list, and more interesting problems to solve than I'd had in years. There's something I want to be precise about, because I've told parts of this story to a few people over the past year, and I always notice the same look. Like they're waiting for me to describe some clever move I made, some conversation where I delivered a perfect line, some moment where I outmaneuvered Margaret or Tyler directly. That's not what happened. I didn't outmaneuver anyone. I simply knew what the regulatory environment required. I documented my concerns through proper channels, and I left when it became clear that my expertise was not valued by the people making decisions. The consequences that followed were not things I caused. They were things that were already built into the structure of the situation. The FDA exists precisely because pharmaceutical manufacturing is too important to leave entirely to the judgment of individual executives. The rules that caught Veridan were the same rules I'd spent 19 years following carefully. When the people who replaced me stopped following them, the rules didn't care who made the decision. They just did what rules do. I think about what Margaret said in that first meeting, legacy as a dirty word, as if longevity was the problem, as if institutional knowledge was an obstacle to efficiency rather than the thing that kept the machinery running safely. In most industries, you can move fast and fix things later. Pharmaceutical manufacturing is not most industries. The reason those processes looked redundant to Margaret is that they had never failed. Processes that have never failed look like overkill, right up until the moment they're not there. Tyler is working in healthcare consulting now, from what I understand. I don't wish him any particular harm. I hope he learned something. I suspect he did. I'm in a different city now. Better office, better clients, better view. My daughter visited last month and asked me how work was going. I told her it was the best stretch of my career. She asked why I seemed so calm about everything that had happened. I told her that when you've spent long enough doing work that genuinely matters, work where the stakes are real and the standards are non-negotiable, you stop being surprised when the people who don't respect that work eventually have to answer for it. You just make sure your own house is in order, do your job well, and let the rest take care of itself. She thought about that for a moment. Then she said it sounded like a long way of saying, "I told you so." I told her it was a long way of saying something much simpler than that. I told her it was just called knowing what you're worth.